We know right now that there are between 5,000 and 7,000 people in Maine who've had a brain injury who now are living with long-term disabilities.
Brain injury is truly known as the silent epidemic. Unless you've experienced it, you don't know about it. Here in Aroostook County, we have a high incident rate simply because of the vocational pursuits, logging industry, the recreational pursuits, snowmobiling, and ATVs, moose-to-car accidents.
At this point in time, Maine has a couple of different services.
When patients come for services, they're looking for help, whatever help that we can provide.
We have 103 individuals or spaces available for 103 individuals in a specialized residential support. This is aimed at people who are not able to live on their own.
We provide a slew of therapies: occupational therapy, physical therapy, psychiatric nursing, speech therapy, to address the deficits that they have. They might not know what they need, but they need help, so we help provide that to them.
In addition, we have 8 neurorehabilitation clinics that specialize in serving folks with brain injuries.
An individual can have an injury that's 5 years old and still be eligible for services because the brain has an amazing capacity to reroute the connections in there and find parts of the brain that haven't been used to pick up skills that the old parts of the brain that were damaged once did.
The other important set of services that are offered really come in the voluntary sector. The Brain Injury Association of Maine has been around since the early 1980s, and they've done an awful lot to provide information and resources to families and individuals with brain injuries.
My role here at the Brain Injury Program is I'm a case manager, and what that entails is helping patients kind of navigate through their care, giving them resources for supports at home, with their insurance, advocacy, getting linked with any kind of support that's going to help them pursue their goals and provide them with the highest level of independence.
We, at this point in time, in the state of Maine, do not have case management or care coordination services available to folks with brain injuries. Being
able to know who to call, what to say, how to get funding, how to be eligible for things, how to help get a discount on your medical bill because you can't afford it, helping your landlord understand that you don't have any income, just having people understand what it is that you truly suffer with on a day-to-day basis.
If we can come up with some resources and a system to provide care coordination, we could have a very beneficial impact, and it would be a very good use of the limited resources that we have.
And if you're not in a program that has a case manager available and you have a brain injury, those resources aren't available to you. So it's really important that patients come to a program so they can kind of get the building blocks to understand what is out there for support. We
all work very cooperatively together to try to find the right services and the right kinds of therapies for each individual.
There isn't a handbook that comes along with a brain injury. There's no rules or outcomes that people can expect. Every injury is truly unique because everybody's personality is unique.
It's difficult because most of those services, so the hospitals, the clinics, the residences are located in the more populated areas of the state. So one of our challenges right now is trying to find ways to help folks in the more rural parts of our state access the kind of rehabilitative care that they need.